Hello, Community Action. Today we are here with Sheila Waits from UnitedHealthcare. UnitedHealthcare has come in as a gold sponsor for the Community Action Partnership's annual convention, and we are excited to have you with us. UnitedHealthcare is, and Sheila will talk a little bit more about this, but as Community Action certainly sits well within that social determinants of health space, as we serve families across the continuum from cradle to our seniors, as we work with all families, wanting them to be self-sufficient. Healthcare is such a critical element of this. And Sheila, I know United has done some really great work and creative work to support kind of what's called dual eligible, right? Your Medicare, Medicaid populations, that sort of thing. We just want to say thank you and would welcome your thoughts on United Healthcare, the work you're doing, and community action.
Thanks, Denise, and thank you guys for having us. Again, I'm Sheila Waits, and I'm the State Director for UnitedHealthcare in Arkansas. We started our partnership with Community Action about 10 years ago, and we've been enjoying working with the local Arkansas chapter, and our hope is that we can move this to a national partnership. What we've been doing is helping with food commodities. We've been sponsoring events, feeding volunteers, attending senior center events. We also have the under 65. And the thing about UnitedHealthcare is that we serve the same population. So anybody who has Medicare and Medicaid, that's a dual eligible, but we also have a division that serves the under 65 population for just regular Medicaid. The one thing we find about people with social determinants is that they have a trust factor. And we found that with community action partners, you guys are a big part of that circle of trust for those folks. So being able to get there at the ground level and help you guys, come alongside you guys and offer education in terms of healthcare. Most of the time, they just don't know what's available to them. The resources that we offer, like food benefits, vision, dental, all of that can be considered and given to them and give them an improved way of living. So we feel it a privilege to work with you guys and hope we can expand that.
Well, we appreciate your support in Arkansas and all the great work that you've, there were some audio issues there, I think, a little bit, but we are so excited. Well, it's been great to see what you've done in Arkansas. And I've been to the Arkansas State Association conference in the past, and we've seen how you've been able to interact with the agencies to make sure you're able to explain all the different kind of products and benefits to working with UnitedHealthcare. Could you expand a little bit? You talked about some of those kind of wraparound services that when you have a dual eligible come through UnitedHealthcare, what makes your program special?
Well, if they're just on regular Medicare and Medicaid, they don't get many extra benefits. So we do a lot of things to enhance the benefits that they already have. Vision, a lot of times they can get free glasses up to a $300 value sometimes. We've introduced a food benefit this year. So you guys provide food through the commodities, but we will also allow them to go to the pharmacy or the grocery store to get food and over-the-counter supplies. We also have just education programs. They don't know where to go for what type of services. During the pandemic, obviously, we were out there very active promoting, getting yourself tested and vaccinated for COVID and waiving all the costs for those things associated with COVID. But the benefits that they get through their healthcare program are much more than just paying for going to the doctor or going to the pharmacy. Again, just like you guys, we offer social determinants. And believe it or not, one of the programs that we offer, we help them fill out paperwork for Medicaid. And then we also help find resources within the community. And that's really how we found you guys, is that we were offering to our members food benefits, our resources locally. And I met Evelyn Reed at the CADC in Benton, Arkansas, and we've just expanded that program from there. So we knew early on that it was a partnership that was meant to be, because again, healthcare is a huge factor, especially someone who is low income, who is not educated about their healthcare. So we have representatives that go throughout all of the states with UnitedHealthcare to help educate those people on the benefits that they can get from a policy. So it's really rewarding.
That's fantastic. And I know people who are coming to Boston next week for our conference will be able to visit your booth on site and be able to talk to United Healthcare to figure out how best to partner with United. How can folks who are watching us on Facebook or Twitter or other social media platforms get in touch with United Healthcare to learn more about how they could benefit from the programs you provide?
Well, we're going to be able to provide each local state director's phone number and cell phone number. They can also email me. It's Sheila, SHEILA _ Waits, WAITS, at UHC.com. And I'll connect them with their local state director. Just like in my position, we have somebody in every state, and we like to do grassroots. So we've got multiple different managers and agents out in all 50 states who can connect with each community action partner to try to serve you where you need to be served, whether it's a food pantry, a LIHEAP event, sponsoring something, providing lunch for your volunteers and all of that. So again, we consider it a privilege, and it allows us to come alongside one of the members' trusted advisors, which is a community action agency, to educate them on their healthcare needs. So it works hand in hand, and it's a great program.
Well, that's great. Community Action truly is a trusted voice in local communities in every corner of the country. And I'm glad that there is an individual state rep who can talk to folks, because as you know, healthcare systems vary differently across communities, and you really want someone who knows your state. So, well, thank you again for the support of the partnership here at the national level. And thank you so much for your support at the state level and for the local families. That is such critical needs. So thank you.
Absolutely. And if you guys are at the convention, come by our booth. We'll be there and be ready to answer any questions you have.
Great. Well, thank you, Sheila. We hope to see everybody either in Boston or virtually. You and I will also have a virtual booth on our virtual conference platform. And I hope that you take a look and reach out. So thank you again, Sheila. Thank you, Community Action, and we'll see you next week. Bye-bye.
Thanks, Denise. Look forward to seeing everybody.